Imagine if you were undergoing an operation that could change the course of your life, but at the same time leave you heavily doubtful that it'll be successful in the first place. Given the circumstances, you may not even know what exactly doctors are doing to you, and how in dire circumstances you come to the operation room anxious and jittery about the events that precede while you're down under. Well, frankly, you don't even have to imagine. NeuroWeb offers it all. Hi, my name is Vineet Puranik, and I'm more than excited to present the next biggest product in the massive world of science. For some context, neuromodulation is the process by which electrical stimuli are sent to the neurons of the brain to activate and communicate with one another to solve the more serious effects of depression. Most of its functions and processes are still being researched, as it was recently just discovered only 50 years ago, meaning that its technology is still relatively new to the modern era of society. Neuromodulation is often used as the last treatment option for patients to undergo or reduce and completely eradicate their symptoms of depression. However, despite the effectiveness that neuromodulation offers, many pertinent issues still remain. The main problem is the inability of patients and even other doctors to comprehend or understand the type of procedures and equipment that is used within a neuromodulation lab. However, the most prominent factor that plays a role in the creation of this problem is the emotion that patients feel prior to their procedure. Their brain stress hormones activate, which creates severe anxiety and convoluted thoughts as to whether they want the procedure to continue, which can be a major detriment and obstacle to the procedure itself. Some existing solutions to this issue still exist, the first being an empathetic conversation with the patient. The U.S. National Library of Medicine and the National Institute of Health suggest that the best remedy to the reduction of anxiety in a patient preoperative is to simply converse in an empathetic conversation with the patient. However, this method is flawed due to its negligence towards the occurrence of increased heartbeat and breathing 15 to 30 minutes prior to the procedure. The amount of time given before such a method will not be enough to reduce the doubts in a patient's brain, but will rather make the patient more acquainted with the doctor instead of the equipment around them. The second alternative solution is the use of palliative medicine prior to a major procedure that can often be administered to patients. Palliative medicine is the administration of pain and anxiety relieving medicine that produces endorphins within the brain. These medicines have the reputation for calming patients down and preparing them in time for their operation. However, this method has been severely criticized by the medicinal community as the fact that it creates and raises ethical concerns and the non-required drugs being constantly pumped in to the patient's bodies. Drug addiction is a possible outcome because of the medicine administered to patients, such as adjuvant medicines that reduce pain and anxiety, are over-the-counter medicines that are commonly found in local pharmacies such as CVS. The last identified alternative solution is a faulty connection between both doctor and patient. Prior to the conversation that both doctors and patients have before the procedure, both have a brief discussion of what the patients will undergo. However, on average, according to the Journal of General Internal Medicine, patients have 11-second conversations with doctors about their operation before they're often interrupted. Such a discussion between doctors and patients is vital and if avoided, can have incredibly negative impacts on the patient before the procedure occurs. So, what's the best of the solutions? My solution, NeuroWeb. NeuroWeb is a website designed to inform patients and doctors of the inner workings of a neuromodulation lab. All of the research has shown that many areas and subjects of a neuromodulation lab, such as transcranial magnetic stimulation, are incredibly complex and hard to describe on paper. Therefore, this information has been used to deduce that a website is needed to break these different parts of the different subjects. like transcranial magnetic stimulation, for example, so that patients can better understand how it works and the different parts, such as the H-spring, that function to allow TMS to work. Also, the website has a page per mechanical device and its appropriate explanation so that the consumer will better understand its purpose, completely separate from any other information on the page. The solution will solve the problem effectively, since it incorporates a much different method than any other informational website. For example, Neuroweb includes a breakdown of each procedure and piece of equipment available to patients, which other informative neuromodulation websites lack. This website is often better than other solutions because not only does it enforce ethical validity through the easy to access and usable website, but it also heavily reduces patient anxiety before the procedure they're about to undertake. It clarifies any doubts that people have in their heads about what might happen to them. Additionally, it gives them hope for the efficacy of the treatment, which eliminates the activation of cortisol. Finally, the website is free to use for all users and promotes usage for everyone, so that any patient can log onto the website at any time and at any point in their day and understand what they need to know about their procedure in the upcoming week. This project has the potential to impact the study of neuromodulation because it introduces a method to completely reduce symptoms of anxiety in preparation of methods to reduce depression. The gap that this project fills is that prior to the creation of this product, no single method existed to target the anxiety stimulated by patients prior to the undertaking of neuromodulation practices. Additionally, its easy to interact interface gives it a much more approachable standard for users so that they'll feel more invited to come back to the website over and over. With its pros comes its cons. Unfortunately, Neuroweb had to meet certain time deadlines, and as we know, time doesn't really wait for us. In fact, for the most part, it feels like it's running away from us. As a result, I wasn't able to incorporate all of the aspects I wanted to. For example, the design of my product wasn't able to be perfected to my liking. Not only was this a direct consequence of time, but also because of my inexperience in web design. In addition, I really wanted this product to be part of the domain at MD Anderson Cancer Center, but many obstacles blocked me from doing this. There was a large amount of jurisdiction standing in my way, and frankly, the hospital wouldn't even allow interns to publish a website officially for the center, primarily because it had to go through a judge and comprehended by a series of panelists in order to be passed on through the website. Although I faced these obstacles throughout my time with Neuroweb, I compromised in other fields, such as the mastery of wording for the information I wanted my clients to know of. I also worked with my passion and drive to make sure that the product met my expectations and the approval of many other clients that were actively commuting to Prinsloo Laboratories because their satisfaction was key to the success of my website. Finally, I want to thank my mentor, Dr. Prinsloo at MD Anderson, for the many hours we poured over this project. I was originally motivated to pursue this topic when I first read about a single statistic I read about in the New York Times. This read that over 20 million Americans underwent severe depression each year. And Dr. Prinsloo was more than certified and experienced with all of her work on neuromodulation, which propelled me to reach out and ask for her assistance over the course of the next couple of months as we undertook this project. Our objective was always to put the patients first and to ensure that the product would benefit them over anyone else. With the constant increase in medical costs over the United States, patients should be provided the utmost respect and attention in their stay at hospitals, and Neuroweb does just that. My hope is that in the future, Neuroweb will be the perfect answer for patients and that all of the problems that they have and bear, because patients will always come first. Thank you so much for watching and have a good day. Finally, these are the references that I used throughout my presentation.